Hi guys, for today's videos, I'm going to show you how to treat a person who has a head injury. If you witness an accident and the victim has a head injury, be careful to help. Worry as a bystander. There are still many ways to help a person who has a head. And don't panic and call emergency like 911. You information to the emergency dispatcher, such as your location, what kind of injury or damage that the victim, what was provided, first aid, and equipment used. Ready to help the victim directly. Here's what you can. Here are the symptoms of severe head. First, unresponsive or reduced means deep wound in the head are severe bleeding. Discoloration of skin and head and scalp. There may be deformity in skull, unequal eye pupils, and there is bleeding in the eyes and ears. Then if that you see the person who has head injury, first you can do is make sure that the victim is still. Do not allow the victim to that position. This is important because they might have an injury in his neck and back. So, it's necessary to mobilize the victim. If there are wound and severe bleeding, control the bleeding, apply direct pressure using a clean cloth and press his wound to stop bleeding. Him not to go into the state. Ask if she is called. Are you called? Then if she say yes, give them a blanket immediately. His blood pressure. Talk to the patient to make him feel comfortable. Provide with the assurance that he can expect help from emergency services. Keep until the rescue arrives. If you are a bystander to a victim who has a head injury, these are the important to help him. First, call an emergency rescue service. Second, mobilize the patient. Number 3, control or prevent the bleeding. And the last, prevent the pressure of the shock. That's all for today. Thank you.